Hey everyone. After giving birth, your pelvic floor goes through a lot of changes, and it's normal to wonder when things are back to normal down there. Today, I'm going to share a simple test you can do at home, the balloon test, to check how well your pelvic floor is working in a reflexive, automatic way. This test can give you a good idea of whether your pelvic floor is back to functioning properly after giving birth. Let's dive in. First, let's talk about what's going on with your pelvic floor after birth. Whether you've had a vaginal delivery or a cesarean, your pelvic floor muscles have been through a lot. They've supported you through your pregnancy, and if you had a vaginal birth, they stretch 2 to 300% to allow your baby to pass through. But even if you had a cesarean, your pelvic floor muscles are impacted because they are intricately linked with the abdominal fascia and muscles. Your pelvic floor muscles are part of your body's core system, which works together with your diaphragm, your abdominals, and back muscles to stabilize you and help control important functions like continence and organ support. Now, during everyday movements like coughing, sneezing, or lifting something, your pelvic floor should automatically engage without you thinking about it. This reflexive action helps protect your pelvic organs and maintain bladder and bowel control. But after birth, those muscles might not kick in as quickly as before. So, how do you know if your pelvic floor is back on track? That's where the balloon test comes in. Before I show you the test, it's important to know when it's appropriate to try it. Right after birth, your body is focused on healing, especially in the first 6 weeks. You might feel soreness, swelling, and some heaviness. It's perfectly normal, unfortunately, to experience mild leakage when sneezing or coughing during that time, as your pelvic floor is still recovering and needs time to regain function, especially if you had a pelvic floor or perineum injury like a tear, because scar tissue impacts how muscles are able to contract and relax. Over the next 6 weeks, as your body rebuilds strength and coordination, you should see continued improvement. By around 12 weeks postpartum, most pelvic floor symptoms should significantly improve or resolve. However, if you're still experiencing issues like leakage, pain, or pressure at this point, it's important to seek professional help from a pelvic floor PT, as these symptoms are unlikely to resolve on their own without targeted treatment, and addressing them early can help prevent long-term issues and improving your overall recovery. This is when the balloon test can be a good tool to check if your pelvic floor is automatically engaging again. Just make sure you've been cleared by your doctor or midwife before doing this test, especially if you had a tear or complications. If you're still having issues like pain, pressure, or urgency, it's best to see a pelvic floor physical therapist first, because there may be a higher chance that your pelvic floor is tight and not necessarily just weak. Okay, now to how to actually do the balloon test. You'll need a balloon and a small ball like a Pilates squishy ball to squeeze between your knees. And then here's how you set it up. Now to how to actually do the balloon test. You'll need a balloon and a small ball like a squishy Pilates ball to squeeze between your knees. I'm going to go over each step and then I'll show you what it looks like. So get into a position by lying on your back with your knees bent at a 90-degree angle. Your feet are going to be flat on the floor or up on a chair or on the wall. You can place the ball between your knees and hold the balloon between your lips. Now take a deep breath in through your nose, letting your belly stay stiff as you inhale. Your diaphragm lowers, your ribs expand, and your pelvic floor should naturally relax. This is an important part of how your pelvic floor coordinates with the rest of your core. Now blow into the balloon in a slow and controlled way. As you exhale, your core muscles should engage and your pelvic floor should contract automatically with them. If you notice any outward pressure or bulging in your pelvic floor or your abdomen while exhaling, it could be a sign that your deep core either lacks the strength to support this reflexive action or struggles with coordinating the automatic response. If you struggle with blowing up the balloon without pressure or bulging, shift focus to consciously engaging your deep core. As you exhale and blow up the balloon, intentionally squeeze the ball between your knees. Engage your pelvic floor by closing it and drawing in your abdomen to see if you have the awareness to do this. So, this is what it all looks like. So, I'm going to lay on my back with the ball between my knees. I'm going to inhale to expand, exhale to blow up the ball. And I'm paying attention to what's happening in my belly and my pelvic floor. Now, if I notice that my belly pushes out, which looks like this, when I blow up the balloon, then what I want to do is I want to intentionally contract my core, which would look like this. It might sound simple, but this test gives you important information about how well your pelvic floor is functioning without you having to consciously contract it. The balloon test helps you check if your pelvic floor muscles are reflexively activating with your core. If you can maintain automatic deep core contraction while blowing up the balloon, it suggests that you have adequate strength for this task, plus reflexive coordination. On the other hand, if you're unable to contract or maintain the contraction while inflating the balloon, this indicates a deficit in both strength and or coordination. However, it's important to remember that this test does not check for everything. For example, it won't tell if you have tender points, scar tissue, or tight muscles in your pelvic floor, though those all can impact how this test works. While the balloon test can give you some great insights into your pelvic floor function, it's not a substitute for a full assessment, especially if you're still having symptoms like leakage, pain, or heaviness. A PT can check things like scar tissue from tearing, how well your muscles are relaxing, whether there are any areas of tightness or weaknesses that need specific exercises to heal, how your whole body recovery is influencing your pelvic floor recovery, and more. Thanks for watching. If you try the balloon test, let me know how it goes in the comments below. And remember, every postpartum journey is unique, so be patient with yourself, but also don't be afraid to reach out for help sooner than you think may be necessary. If you have questions about your pelvic floor recovery, ask them in the comments or reach out to pelvic floor physical therapist. Don't forget to like this video and subscribe for more postpartum tips, and I'll see you next time.